All right, now back pain is caused by a lot of things, but tonight we're going to kind of focus a little bit on what we call a vertebral compression fracture. Kind of tell us what that is.
Well, it's a fracture within the body of the vertebrae, which is the largest part of the vertebrae. It's a weight-bearing part of the spine.
And it kind of crunches down when that happens?
Basically smashes. That's what a vertebral compression fracture is.
I always think of a Coke can smashing. And
akin to that. That's a good analogy.
Okay. Why would that happen?
It can happen for a number of reasons. Probably the most common reason that I see this would be in patients that are afflicted with diminished bone density, with osteopenia or osteoporosis.
And that's like, especially in women, postmenopausal women would be
particularly Caucasian, Asian women that are older. That's the typical profile.
Okay. Trauma or any other causes lead to that?
Occasionally.
So if you have back pain, what are some triggers that, maybe it is a compression fracture or you ought to see your doctor?
Well, if you have some of those risk factors, as I said, if you're an older woman in particular, Caucasian, Asian, slight build, in somebody who's had other fractures, these are all suggestions that you may have diminished bone density, and it puts you at very high risk. So in my patients that are aware that they have these conditions or some of these risk factors, you need to have a high index of suspicion when one develops severe pain in the back, often for seemingly as a result of trivial issues, a mild fall. Sometimes there's no history of trauma, even a minor trauma, and one can develop symptoms.
And you use the term severe. It's usually not a mild ache. It's something's really going on?
It's generally a pretty profound pain, and it tends to be worse when patients move. Often patients that are afflicted with these compression fractures are much more comfortable maintaining one position and essentially being immobile.
Okay. So if you want to prevent this, is there any way to prevent it?
Well, one needs to get to the root cause, which in most patients, as I said, would be diminished bone density. And that's something that's typically dealt with at a primary care setting with treatment with medicines sometimes. Regular exercise is important. The stress of regular exercise is very important to help maintain the integrity of bones.
Yeah. Well, that's what we do in our office. We do the bone densities to look for osteoporosis, check their vitamin D levels, and sometimes put them on medicine to try to keep those bones strong so they don't have to come and see you. But
that's ideal.
But there are times when it happens. They end up with a compression fracture. They end up coming your way. How do you treat it?
Well, we tend to be very aggressive with this. Historically, say a decade and a half ago, patients would be put in a brace and kept at bed rest, given pain medicines, which caused a slate of other problems. So we tend to be much more aggressive in this day and age, and we will do an augmentation procedure, what we would term a kyphoplasty, to address this now.
Now we brought a video with us, and maybe you can kind of tell us what happens here.
This is a side view of the spine, and either a biopsy needle has been placed into the bone to create a track, and then the balloon, the Kyphon balloon, is inserted and inflated. This helps compress the shards of broken bone, and it creates a void within the broken bone. A catheter is then placed, and cement is placed within the defect that's been enlarged. And the cement goes in sort of a toothpaste consistency and then becomes hard as a rock over a period of a half an hour or even less.
So it takes a crunchy bone, blows it up, and puts some cement in there and makes it...
Basically, it's an internal cast for the bone. It's providing support. We're filling a bad foundation with some cement, and it provides support and helps to diminish symptoms.
Now, how do you know when somebody needs a kyphoplasty? Or me as a primary care doctor, do I send them right away? Do you do it at the first day? Do you do it at 2 weeks or 6 months? When's it appropriate to do?
I think most providers that are doing this procedure like to do it earlier on. Patients tend to respond better, and by that I mean within a number of weeks. The sooner the better. In patients that are in profound pain, there's a lot of morbidity that can occur when they become immobile and off their feet. There are lots of complications with that. So the kyphoplasty is very effective in getting people's pain reduced and getting them back on their feet. So I like to do this very early on. So if you have a suspicion of this, I like to get a study to document that they have a fracture, and I'd like to see them quite soon after that. This procedure is not as effective if you wait a year or longer. when some scarring has occurred and the bone has healed in somewhat aberrantly.
Okay, so when you have this procedure, it looks pretty slick. I mean, it's outpatient? You have to stay in the hospital, or?
Typically, it's an outpatient procedure. With my patients, they're kept at bed rest perhaps for an hour, and then I get them up and walking. Once they're up and walking and voiding, we send them home.
And in my experience, which is limited, you do a lot of these, it's like night and day. I mean, they have the procedure and then they get pretty good relief.
In the majority of patients get very, very good relief. There's a range, and sometimes patients have symptoms related to other things as well. But when you treat these fractures, it's a very gratifying procedure. People get up, walk away, and are often smiling.
It's great information. It's a great procedure. Can really give some pain relief.